Good afternoon, G-Bond, and welcome to our video version of our town hall meeting. This is a great way to do things and a very efficient method for us to get the message across. You'll be hearing from many of us on the executive team today, and I'm hoping that if you had submitted some questions, that your questions are answered today. I think by now you've noticed that there are quite a few new people walking around. Please don't be afraid to introduce yourself to them, tell them what you do, ask them what they're doing. I think it's great that we have the new people walking around. They feel like part of the family. The quicker that happens, the better off they'll be part of the culture here at G-Bond, and they get to feel really all the good things that we do here for ourselves, for the company, for the members. We now have nurses on the third floor. They report to Nadia Vasquez, and they will assist with many of the projects that we have going on. I think I've told many of you in the past that G-Bond is not just about care coordination, and the addition of the nurses to the G-Bond staff is a clear indicator of that, right? There are much bigger things happening as we renew our contract with YourCare, as we start a new contract with Fidelis, as we continue to work closely with United Healthcare. A lot of these things come together, and healthcare delivery is reshaped by way of the value-based payment. I think you'll see many changes and some new additions with some new positions. You all have a good management staff that you can ask questions of. You all know how I feel about reaching out and finding the right answer for things. For those of you that deal directly with the membership, you know how I feel about being very direct with that membership, and frankly, being very honest with them. If you don't know the answer to something, say, hey, you know, I don't know that, let me get back to you with that. If you promise that you'll be calling them at 2 o'clock the next afternoon, you call them at 2 o'clock the next afternoon. If you can't, don't have anything for them at 2 o'clock, well, then you call them and you tell them, you know what, I told you I'd call you. Unfortunately, I wasn't able to get the answers to your question. Give me another day and I'll be right back with you. They will appreciate that. If you take notice of their lives, it helps in making them more compliant with the doctor's instructions, which frankly is one of the many reasons that we do what we do. I want to remind you of our vision of this company, to become the health home of choice for our chosen marketplace. The health home of choice, what does that mean? And what does that mean to you? What have you done today, yesterday, to make sure that G-Bond is on the path to becoming the health home of choice? If somebody is in need and they're given an option of a health home, I want them to pick G-Bond. I know this family. This is a good family. We do good things. We help people's lives. We transform lives. I want them to be here. No reason for them to be anywhere else. Now with the addition of Mid-Area Counseling and Treatment, they're going by Endeavor Health nowadays. It's a great way to integrate behavior with primary care. If you look around the state, I gotta tell you, there's not many organizations that are capable of doing that or even know how to do that. Remember our mission, to transform healthcare by removing barriers created by social determinants of health in underserved communities. And as you look around, we work in the midst of one of the poorest zip codes in one of the poorest cities in the country. This is an underserved community. The person that you deal with, the person that calls you every once in a while, who may have a behavioral problem or not, is living in an underserved community, the disenfranchised. So again, I thank you for what you do. It's important work. It's good work. Feel good about it. And again, thank you for taking the time today to join us on this video conference. Have a good day.
Hello, G Health. How are you today? I hope this finds everyone well. I'm just here to give you a few updates from the Outreach Department. First, I'd like to thank my entire team. To Gabby for doing an amazing job, and also for Jessica. You guys have been fantastic on so many outs. But guess what? Things have really changed in outreach. And so I just want to share a few with you. We are taking a much closer look at our daily production, how many enrollments we do, how many DSCs and CSCs that we speak to. So data is super important. If it's not documented, it didn't happen. So I'm encouraging everyone to hit your goals per day, and it will help all of us to reach our goals. Thank you to all the PHNs who do give us referrals, and that's another change. If you go to gbon.org and you go over to the contact on the immediate right, just click and you will see Health Home Referrals. You must complete this eligibility form in order to refer to the outreach department. We'll get that information immediately, so we're asking everyone to please, please, please use that information, use our contact referral form that is on the GBON site. Also, we are currently looking for block clubs and churches that have events that we can tie into. So if your block club, the street you live on, is going to have an event, and or your church has a weekly Bible study or some type of event that we can key into, please feel free to give me that information and we will get it done. This year, we're doing all of our normal summer outreach, including Juneteenth, Puerto Rican Day Parade, and we've also added the Funk Fest, which will be taking place in August. We are going to need additional staff in order to meet all of our tremendous goals this year in outreach. I'm asking all care managers, when someone comes around to sign up your staff, that you would encourage them to become a part of those events, because the more people that work it, the less work it is on everyone. Once again, I thank each and every one of you who's always doing the absolute best. I thank you for supporting outreach, and I look forward to seeing you in the next quarter. Good luck and farewell.
Good morning. My name is Ron Gales. I am Director of Supportive Services. I cover member services as well as transportation. At GBON, there is a term called triple aim. Member services is taking a look at this triple aim. First, we improve our members' experience with GBON. Second, we improve our members' health. And third is to reduce costs. Member Services is looking at reducing costs by categorizing return mail. We receive 60 to 70 pieces each month of returned mail for various reasons. We will be tracking bad addresses. If we're able to mail it, remail it, we will do that by Googling the correct address or checking in Medit what it was supposed to be. And we will also be tracking repeat offenders. We will be letting you know, along with your care manager, if you are one of these people. We are hoping to cut this in half within the next month or two. In transportation, we want to ensure we are using our drivers to their capacity. Schedules are made out sometimes 3 to 4 weeks in advance. On a daily basis, we have cancellations, no confirmation, and no-shows. This opens up the window of opportunity for the PHNs. Yuritsa will be sending out updates to the care managers either late morning or early afternoon, advising of the availability of open time slots for that day. This would allow you, the PHN, to make use of any last-minute requests from your members. We hope we will improve our members' experience with GBON. We're looking forward always to improving their health, and we're also trying to reduce that cost. Thank you for taking the time to listen to me, and thank you for all the good work that you do here at GBON.
How you doing, GBON? Welcome to another quarter of 2019. Now, give you a few updates on a few things that we're doing. Care plans are in the way, and we are retweaking the interoperable care plan that we're working on. Dr. Vasquez updating a few things before we go live with it. But I also want to welcome the new staff that came on board for this first quarter, and the staff that's coming on board for the next few months that we already have hired and working on to getting them into the family. We also have a few promotions within the groups. You'll see throughout we promoted Marielis. We also have a few folks that are leaving us, and a few folks are taking lead in those areas, and those will be mentioned later on and as we go. For the PHNs, we're doing a lot better when it comes to the contacts and everything we're doing in-house and the case management component. I want to give an applaud to my management team, care managers, outreach, every single department that's doing a great job in working together and cohesively, working together with even Heather as well, looking at the billing component and how do we make sure that we are on target on a monthly basis. So kudos to the teams on doing way much better outcomes when it comes to doing everything we do and providing services for our members. And because of that and the growth that we're doing and the push that we have for outreach to basically bring new members to the family and work together and grow this company to another level that we're trying to do for 2019, we have to look at different platforms and different things in order to become more mobile. So that being said, we are looking at a platform to become mobile when it comes to being, what I mean by that is working from home or working in the community don't have to come into the base in order to start your day or finish your day. So that being said, we are working on that platform, which should be in a couple weeks. But then again, we're going to start phasing it out with the certain pilots and certain things that we want to do. But just to let you know, we are working on that. I know we mentioned it before, but now it's here. Now we really have grown to capacity when it comes to even this location on having PHNs and case managers assigned to this location. We're outgrown the building. So next phase is how do we become mobile. But again, keep doing the great job you guys do. Again, we have a few deadlines that we have to do with your managers when it comes to care plan, when it comes to different documentations that we have to update and become in compliance with. So if your manager reaches out to you, you have to finish a few things and complete a few things for us. Let's work as a team, let's get it done, and let's complete the task at will. So first quarter, great start to the year. Let's continue the great work, and let's continue to grow GBON. Thank you. Have a great day. Bye-bye.
Hello, my name is Marilee Rivera. I'm the new Director of Care Coordination. My goal this year is to lead the Care Coordination Department to reach the company's goals. With that being said, we promoted 3 individuals. Those individuals are Shakina Cunningham, Pamela Taylor, and Judith Pirella. Thank you, and to all the mothers, happy Mother's Day.
Hi, good morning, G Health. My name is Jason Isbrandt. I'm the Director of Marketing and the Director of Provider Relations here at G Health Enterprises. And welcome to another live stream town hall meeting. I'd like to talk to you a little bit today about what's happening here in our marketing department. I'd like to break that down into 4 sections for you. Number 1, newsletters and current mailings we have going on. Number 2, advertising, where we currently advertise and where we plan to advertise. Number 3, some of the new branded collateral items that we have to share with our members, whether it's at events or throughout the course of the work week. And then I'd like to talk to you lastly about the events. It'll be a busy summer for us here at G Health as we have 10 events on the calendar, including 2 really nice, important events that will bring not only the company together as an employee all event, but also the employee and their families for a summertime picnic this year. So let's first talk a little bit about the newsletters and the mailings. So currently here within our department, we are producing an intra-office memo which goes out the second Friday of every month. And thank you to all the directors and thank you to everybody here at G Health who continues to provide information to us so that we here in the marketing department can produce such a robust intra-office memo to keep everybody in tune as to what's happening here at G Health. Number 2, we have a GBON member newsletter. The GBON member newsletter goes out every other month, typically goes out on the first Friday of every month, and again, helps keep our members in tune with what's happening here at G Health. Number 3, we have a G Health Network newsletter that does go out every other month, opposite of those months of the GBON member newsletter. So we like to keep our network of providers in touch with, again, what's happening here at G Health. bring them up to speed on all of the events that we are taking place in, and again, the happenings of what we have to offer here at G-Bond and G-Health. And number 4, if we talk about monthly mailings, we are currently sending out monthly mailings geared more around the targeted disease state of what's popular this month. Like, for instance, here in May, right now it's blood pressure awareness and asthma awareness. So we are targeting urban family practice patients and G-Bond members and patients to really send them out a mailing to let them know, if you haven't had your blood pressure checked, if you haven't had your asthma looked at, now's a good time to reach out to your primary care physician and let them know that, it's a good time to get that checked. So that's where we stand right now with newsletters and mailings here in the marketing department. As far as advertising goes, my department has been very active in advertising, not only on the Lamar billboards, which I'm sure most of you have seen the static billboards around town. We're also on the digital billboard. On the digital billboard, we bounce back and forth from the 33 to the 190. So keep your eyes open for some of those billboards as we proactively advertise UFP, we advertise G-Bond, we talk about a little bit about Jabaco, our ACO. We advertise when we're hiring for folks within G-Bond, hiring for folks within urban family practice. And then again, we want to highlight a lot of the important events that we have coming up this summer. Besides the static billboards and the digital billboard, we also advertise on the buses. So whether you've seen it or not, we're on the back of the Metro buses. We're on the sides now of the Metro buses. So again, keep your eyes open, and if you see those buses around town and you have time to snap a picture, we would love to see it in the marketing department. So forward it on to myself, to Christian, or to Sully in the marketing department. Besides the buses, we're also advertising in the Challenger newspaper. So we'll be involved in the newspaper every 2 weeks for the next 6 months. So giving us about 26 weeks worth of advertising in the Challenger newspaper. And again, some of that advertising will be highly advertised towards our events, towards positions here that are available at G-Health, or we'll kind of curtail some of that advertising around, again, some of the fun things that are happening here, throughout the course of the year, whether it be Mother's Day, which, quick reminder, is this Sunday, May the 12th, so don't forget Mom. But we'll advertise and say thank you to a lot of our community-based organizations too as well through some of that advertising. In the fall of this year, we look to co-brand one more time with Your Care on WGRZ Channel 2. We hope to have Dr. Vasquez back on Channel 2 for a live taping, and we also hope to advertise in their digital media too as well. So I talked about newsletters and mailings. I talked a little bit about advertising. Let's talk about some of the branded materials that we went ahead and purchased. So we're looking at tote bags, we're looking at stress balls, sunglasses, water bottles, pill cases, keychains. We've ordered some of those mirror compacts. We have first aid kits on the way. Some of the advertising is branded G-Bond, some is branded G-Bond in Your Care, some is branded G-Bond in United Healthcare. So again, feel free to stop into the marketing department, talk to us about some of the neat giveaways that we have, and obviously at all of the events that we'll have this summer, we will make these items readily accessible for anybody that attends those events. So finally, what I wanted to update everybody on here as well, which is probably one of the most important pieces of my conversation with you, is about all the upcoming events. And I'm going to walk us through a list of calendar events that we have currently on the calendar. And then just to give you a quick update is on Performance Central, we're going to attach a events calendar so that everybody here within the organization can visit that events calendar on a daily, weekly, monthly basis and really, become familiar with what's on that events calendar, so that just because you're not working the event doesn't mean you can't or you don't have to show up. We'd love to see you at all these events. So our first event to kind of kick off the season will be on Thursday, June 13th, and that's our Corporate Challenge. This is the second year in a row that we're co-sponsoring the Corporate Challenge with Your Care Health Plan. And currently, as of this morning, we have 72 people registered to run or walk in the Corporate Challenge. Now our goal is 100 people, so we're almost there. Last year we had 65, so we have surpassed last year's numbers, but it should be a fun event. So if you haven't signed up, please look back through your email. I'll probably hit you with another email, but we'd like you to click on the link, sign up to walk or run. Again, we're less than 28 folks away from hitting our goal of 100. Plans to be a great event. We have a catering section with a nice tent, tables and chairs, a DJ. Food will be catered by Chevettas. We're going with a beach theme this year, so so the entire tent will be decked out in beachwear. It should be a lot of fun. We're looking forward to having you out at Delaware Park is where the run is actually held. Again, that's Thursday, June 13th, and it's a co-sponsorship between G Health Enterprises and Your Care Health Plan. The next event, staying with that same weekend, is Juneteenth weekend. So that is Saturday and Sunday, June 15th and 16th. Come on out to Martin Luther King Park, where G-Bond will have a huge presence. We'll have our RV there. We'll be enrolling patients on the spot. We'll have a couple of our insurance partners there to facilitate enrollment if folks need insurance. Plans to be another fun weekend for us. It's Father's Day weekend, so that in itself is always a fun event. But we'd love to see you out at Martin Luther King Park on Saturday and Sunday, June 15th and 16th. Sticking with June and the calendar itself, we're going to look at welcoming Endeavor Behavioral Health Services here into our building. Although they've been here in the building for a couple of months now, we're actually going to cut the ribbon and we're going to have a press conference announcing Endeavor officially being here in the building. And that's going to take place on Wednesday, June 19th from 4 to 6 p.m. Keep your eyes on your email because I'll be sending out a calendar hold or a calendar invite for that particular event, but we'd like everybody here within the organization to stick around on that Wednesday to kind of welcome Endeavor into the facility. We hope to have some good press coverage, some good news coverage and conferences there to kick that off as well. I'm going to skip the next event that's going to take place in July because I want to come back to it because that's one of our fun corporate G-Bond events, so we'll talk about that at the end. Let's talk a little bit about the the UFP Health Fair, which will take place right here on Niagara Street on Saturday, July 27th from 12 to 5. Again, we have a lot of fun things planned for the health fair. There'll be screenings, there'll be food, the Mammo bus will be here. We're going to have a dunk tank this year, so we're going to get to dunk the dock, bounce houses for the kids, pony rides for the kids, face painting, cotton candy, popcorn, haircuts, you name it, we're going to be doing it out there. We're going to be giving away some things throughout the course of the day as long as screenings are being done. It should be a really fun event, a good DJ that we have coming to DJ the event too as well. So we hope to see you again, and that is Saturday, July 27th from 12 to 5 right here on Niagara Street, where we're going to block Niagara Street and turn it into a big health fair block party. Let's talk a little bit about the PR Day Parade, which takes place on August 17th. So we'd like you to have as many folks to come out, meet us down in Niagara Square to get ready to march the length of Niagara Street all the way down to Porter Avenue and then over to LaSalle Park, where we have again a tent this year at LaSalle Park. We'll be advertising G-Bond. We'll be enrolling members into G-Bond. It'll be a fun event. We'll be giving away a lot of stuff, and hopefully the weather, which worked out last year, will be in our favor again this year, and we look forward to that. So here's a new event for us this year. On August 22nd, 23rd, and 24th, we finalized a sponsorship to be a partner with the Rick James Tribute Funk Festival, which will take place not only, this 3-day event will take place at Martin Luther King Park, will take place at our site over on East Utica and Jefferson, right in front of Urban Family Practice at Jefferson. And then the last day of events take place at LaSalle Park. So they put about 8,000 to 10,000 people into LaSalle Park. There's a live concert. It's a tribute to Rick James. It's a lot of fun. Again, we hope to have as many of our folks participate. We'll have plenty of outreach there. We'll bring our RV, and we hope to have a lot of fun. And again, hopefully the weather works out in August, which I'm sure it will. The last two events I'll talk about before I get to the G Health events are the golf tournament, the annual charity golf tournament, which takes place on Friday, September 20th. If anybody's interested in sponsoring any of the holes or sponsoring a foursome, please reach out to me directly and we'll make sure that they get information into their hands. And the final event of this year right now leading into the fall would be the one-day housing event that we will partner with Your Care on October 24th along with the Salvation Army to have a one-day housing event over on at the Salvation Army on Main Street. So again, we welcome anybody to come out and take part in that event. If anybody's interested, please feel free to get a hold of Ava White in the outreach department, or you can reach out to me directly in marketing, and we'll be able to help you out. So the last two big events, which are more of surprise events, I think the word has gotten out here at G Health Enterprises as to what's happening this year. But the first event, which is more of a corporate event, so it's an employee-only event, will take place on Thursday, July 18th, where we will take the Miss Buffalo out on Niagara River for 3 hours this year. So from 6 to 9 on Thursday, July 18th. You're welcome to join us down at the docks to board the Miss Buffalo at 5:30 p.m. and take a trip down Niagara River for 3 hours. Food and drink will be included. We'll have a DJ on the boat like last year, and it plans to be a lot of fun. The last event will be our G Health Company Family Summer Picnic. thank you to Tony and Dr. Raul Vasquez for giving us the ability to take not only the employees but our families as well to Darien Lake on August 10th, Saturday, August 10th from 10:30 a.m. to 10 p.m. Free parking, lunch will be served, dinner will be served, t-shirts will be handed out. It's all the rides, the water park, all sorts of fun events. So keep your eyes open for 2 important invites to be sent for the G Health event and the Miss Buffalo event, and then the G Health event, which is the summer picnic event. We're going to need an RSVP for both of those events. So I'll work with my department on getting a Eventbrite out to everybody so that you can respond as to, again, how many tickets you need, more importantly for the G Health Family Summer Picnic, and as far as the Miss Buffalo goes, if you plan on going or not. So again, it sounds like an action-packed summer into a fall, 10 real big events, not to mention a lot of the other pop-up events that we're going to do. And what I'd ask you to do is keep one thing in mind, and I heard this the other day when I was looking through some of the social media posts, and again, it talks about life being full of choices, and it broke it down into 5 different choices. You can make bad choices, you can be average at what you do, you can be good at what you do, which at this point is probably the norm for most everybody that is involved in some kind of working relationship. You can be excellent or you can be elite. But in order to be excellent and elite, which is what we strive for here at G Health Enterprises, is it really comes down to 3 basic characteristics: passion, attitude, and work ethic. All 3 of those, if you continue here at G Health Enterprises to put your best foot forward, you can go from good to excellent to elite in the minimum amount of time necessary. With that, I'll turn it over.
Hi, I'm Erin Nardozzi, the Director of Compliance and Quality, and I have 2 updates for GBON today. The first one is the department changes with quality and compliance. The departments have merged into one entity, and I am now overseeing quality in addition to compliance. Underneath me is Lisbeth Rivas. She is the Assistant Director of both departments. And underneath her is Jose Santiago, a Quality Enhancement Specialist. And we are also hiring 2 additional Quality Enhancement Specialists. The second update I have for you is about Relias. And Relias going forward will be based on credit hours, meaning instead of having a list of courses to take every month, you will now only need to acquire 4 credit hours per quarter. So in this picture, you will see how simple this is. 4 credit hours every quarter are required going forward. Thank you for your time.
Hello G Health, my name is Nadia Vasquez. I'm the Senior Director of VBP here. Firstly, I would like to extend the warm welcome to Michelle Lane, Jennifer Fernandez, and Chelsea Adamski to the VBP team. They will be available to answer any questions patients or members may have regarding the various quality measures we have. Please remember that they will be triaging you with all the quality measures such as medication adherence and preventative screenings that your members need and we need you to follow up with. Endeavor is on the first floor for your members who do suffer with substance abuse and mental illness. As a reminder, please be mindful when referring members to these services. Only use a rating of priority for the members that truly have a priority status. We want to ensure all members are getting the proper follow-up that they need, but it makes it much more difficult if we cannot differentiate the needs of the member. But for those members that are your care and are suffering with substance abuse, we do have an RN that is available to work with these members to ensure that they do get the care that they need. These services include care coordination, behavioral health counseling, and regular PCP follow-up. The GBU-IPA emergency room diversion line will begin May 13th. This line is available to all GBU-IPA patients who have 3 or more inpatient stays and or 4 or more ED visits in the last 12 months. The GBU-IPA doctors include Urban Family Practice, Dr. Haddad, Dr. Lewis, Dr. Douglas, Dr. Gales, and Dr. Forte. The 4 triage nurses are Catherine Ball, Jessica Campbell, Caitlin Weedle, and Kimberly Buziak. We'll work directly with members to provide clinical care management. If you have a member that is eligible for these services, please contact Demetra McLean. She is the project director for this grant, and she will work directly with you and your member to get the services that they need. We still have 35 Medicubes left. The Medicube is an automatic pill dispenser that enables members to take their medications at the time and the correct dosage with ease. Unfortunately, a significant number of unnecessary ER visits are due to medication and non-adherence. We believe that utilizing the Medicube can significantly enhance the quality of life for our members as well as prevent costly ER visits. Features of the Medicube include many services. The Medicube can hold up to 16 different medications and dispense scheduled of each medication will be programmed with the PHN at their first visit. This can include many medication that can be controlled or non-controlled depending on the member's needs. We can discuss this at the member's home with the PHN, and we just want to make sure that the PHN is there during the initial encounter to make sure that the member has built a rapport with the nurse. From there, we will take it from there to make sure the medication is picked up and taken with the member at their scheduled dosage times. Requirements for the Medicube are we are looking for G-Bond members that are part of the GBOIPA who may benefit from having the Medicube installed in their home. We want to prioritize those who have had 3 or more inpatient visits or 4 or more ER visits and who have at least 6 or more medications. If you have a member who meets these requirements, please call or email Demetra McQuain. She will then work with you to make sure that your member gets the services that they need. For wellness, so we do have smoking cessation classes starting tomorrow, May 8th at 9:30 a.m. down in nutrition classes. They will continue on every Wednesday at 9:30 for 6 weeks, and then they will no longer be there. We do have a new software is coming out. It's called HeartZone. Please look into it. It will be available for both employees and members. This software will be a heart monitoring system that will allow for members and employees to utilize in the gym. Training calendars are continuing to be sent out monthly. If you are interested in attending the training courses, please do so via SharePoint. For more information on how to access this area of SharePoint, please contact Kimberly Cedeno.
Hi, my name is Letitia Rusi, and I work for the payroll department and also the finance office. I'm going to talk to you guys today about entering your vacation, sick time, and any other PTO time. So what's happening is that people are not entering their time into paychecks so that when that's approved, that amount of time, so let's just say 8 hours of vacation, you enter it into paychecks, your manager approves it, and that 8 hours gets taken out of your bank of time that you have. So we're finding that a lot of employees are not entering that time into paychecks. And ultimately, it looks like it looks like you took the day off, but then you never, got that 8 hours taken out of your bank. And the issue with that is, so it looks like you're taking leave for free, and you're not taking any of your hours out of the bank. And this is happening more and more. So we're going to start watching this closely. And, obviously we're going to give you a chance to memo this time. When I mean memo, means enter it into paychecks so that your manager can approve it so that those hours get taken away from your bank of hours. May it be sick time, PTO time, whatever hours you plan on taking. We're going to watch this closely. And hopefully you will all do it so then I don't have to give you a call and, talk to you about entering your time into paychecks. So that's all I have to say. Thank you.
Hi, my name's Gabrielle Diaz, and I've worked for G-Bond for about 5 years now. And I'm the new outreach director, and I'm looking forward to all the new challenges and the new position that I've been directed to.
Hello again. So I wanted to come back and have a conversation about certain responsibilities that we all have. Managers have certain responsibilities. All the employees have certain responsibility. Let's talk about time off. Time off, we all know, it's in the rules. We must request it at least 2 weeks in advance. The privilege of personal time off and sick days as well as vacation time, all that stuff is earned. So the only days off for a new person, somebody brand new, basically are the 11 days off that we give every year, right? We know what those days are. They're in the employee handbook. After the first year then, those days start to get earned, PTO, sick days, vacation. If you put in your time and it does not get approved, know that you run the risk of not getting paid for the days off. So work with your manager, confirm with your manager that basically they have approved the time off, all right? Sometimes in the past, we've seen where managers have gotten busy and things don't get approved until the last second, or sometimes after the fact. I can't have that anymore. So we all need to be responsible for what our needs are. And if you need a day off, and if you've put into it, right, after your first year, then confirm with the manager that they actually approved it so we have no issues. You don't want a situation where you ask for and take time off and then don't get paid, because unfortunately, that's one of the things that I'm going to instruct HR that they have to do starting on Monday. Managers, frankly, I expect the request for approved or denial of time off request. I expected that they could turn around in 24 hours. Actually, let's make it 48, give you guys a break. 48 hours of the request, that stuff should be approved. Care managers, I need you to make sure that your direct reports, your PHNs, your people that work downstairs, anybody who works in here, you've got management, please make sure that those folks mark the days off in paychecks that they're going to take off, such as PTO, vacation, sick days, bereavement, so that the system keeps good records. This will definitely lessen the need for after-the-fact audits and reconciliations. Reconciliations, it may mean I go back and charge back for a day that frankly you shouldn't have gotten off, or go back and charge back for a day that frankly you forgot to put into paychecks. We all know the rules, we all know how to do it. If you don't know how to work the software, talk to your manager. Your manager will find those that need to get retaught with it and bring in HR for perhaps another training session. Every week, my experience is that payroll gets delayed because this does not happen. I've got to stop that. I know you're all busy. So is everyone else. So we got to do what we have to do, right? The other thing is that all managers need to be on the same page with people starting this. And I mention these things because I'm talking to the managers, but I'm actually talking to everyone else, because what you do impacts what the manager has to do and the time that they have to do it in. So we need to be on the same page with everybody's tardiness. Multiple tardiness will be written up. In the past, we've got some people, I don't want to see examples of where you're 14 times late in the past 2 months. At that point, I have to go talk to the manager and say, why haven't you written this person up? And they have written up, well, has the situation improved? And if the situation is not improved, don't forget that we are on an escalating manner of discipline, right? You go from verbal to written, from written to suspension, that basically I need to coach you off the bus. I don't want to coach you off the bus. It took me a long time to train you. I invested a lot of money in bringing you to where you need to be able to do your jobs. So I need you here. Managers, you need to be on the same page when it comes to dress code. I still have some people wearing sneakers, and the sneakers are shouting out the very bold colors, hey, I'm a sneaker. I can't have that. It's not professional. It just takes away from the image that we're all trying to present. Over the course of the next few weeks, few months, you're going to see some changes in management, people growing into different departments. Notice that I said growing into different departments because the company is growing. I'm of the opinion, as is upper management, that this company is about to take off with a lot more people and a lot more employees. We need to enter a phase of strong professionalism to rival that of major corporations that we have here in Western New York. We can't sit aside and say, let's keep running business like we always have. My expectations of everyone must be at a certain standard. If they're not, then frankly, I'll find anyone, okay? Change is coming, you know that? Change is good. Change is good for all of us. I've got some people here that have started the CHWs, have become directors. I've got some people here that started the CHWs, gone to PHN, gone to care manager, and beyond that. That will continue. Another point that I'd like to make. Every once in a while, we all have lives outside of GBON, I know that. And at times, some of that outside life comes to play here inside of GBON. Sometimes it gets handled professionally, sometimes it gets handled maturely, other times it turns into drama. Drama takes away from what everyone else does and the good work that everyone is trying to do. That needs to be curtailed. It's done. Okay, it needs to be curtailed. Look, The greatest majority of us work hard, we work effectively, we work diligently, we work efficiently. We need to make the majority of us work with that same work ethic. Okay? I can't have only 40% of the population that I have here working diligently and efficiently. I got to increase that percentage. We recognize, and on behalf of upper management, on behalf of the E-team, all of our directors, look, we recognize the work and the hard work that everyone does here at G-Bond. We are very appreciative of that. So on behalf of the members, I say thank you. On behalf of G-Bond, I say thank you to you for the work that you do. You should be proud of the stuff that you do and the work that you do for each other as well. Again, thank you very much. Have a good day.
Hey everybody, this is Michael Hardy, and I'm here to tell you about the 401k plan and also inform you how to participate in the 401k plan. I'm with Mollett and Hardy, and we've been doing this plan here for y'all for at least 6-7 years. So some of you may know me, and those that are new here will find this informative. So first of all, I'd like to start by discussing the 401k plan and letting you know why I think you should participate. It is a retirement plan, which is for your benefit. It'll let you put in either a dollar amount or percentage of pay each paycheck, and that is going to go into your own account, of which you would get a quarterly statement and online access. The benefits of participating in the plan are, one, it's your money, so you're saving your own money for the future, and you're letting your money grow in a taxed favored place. So not only will you get a tax deduction for each contribution going into the plan, but you also receive the tax deferred growth of the money as it does earn interest and dividends and accumulation over time, which is the beauty of participating. You can participate at any level, whether it be 1 or 2 or 5 or 10% of pay, or you can participate by choosing a dollar amount, whether it be $10 a pay or $500 a pay. You have really no minimum amount to put in, but the maximum is $18,000 per participant each year. So you have a lot of room to save in the plan if you'd like to. I would encourage you to start as soon as possible. A lot of people wait, and waiting is your enemy. So the earlier you start in your life, the longer you have to let that money grow, and the bigger the value will be later on in your life. If you should leave the company, it's still your account. What you will do is contact me in terms of how to transfer to your next employer plan or into an IRA where it can continue to grow for your retirement. Also, you do have a loan provision on the account, so if at any time you need to borrow against it, you have to have a $2,000 or more balance. You have the option to borrow from your own account and pay it back through salary deferral if you choose. So, an account which is voluntary for you, you have to put it in though in order to benefit. You get tax benefits, growth benefits. There's about 25 different investment options, from conservative options all the way to aggressive options, to allow your money to grow for you, and you can take it with you wherever you go next. There's a million reasons why you should participate, even if it's at a very minimal amount, or you can get a lot in there to really bring down your taxable income and save a lot for yourself. Those are the main reasons to start and to participate in the plan. So how do you do it? Well, there's a couple ways. The easiest way is really just to log on to paychecksflex.com, Paychex and you can actually enroll right online at Paychex Flex. You're going to type in your information, your name, Social Security, and you will come up, and you'll be able to put in what you want your deduction to be, and you can start, and you can pick your option, and you can take care of it right then and there. That's paychecksflex.com. If you want to discuss it, give me a call or send me an email, and we can talk about it, and we can either do a paper application together, or I'll come out and see you, and we'll do it one-on-one. My number is 691-7121. Again, that's 691-7121, or you're welcome to email me at Michael, M-I-C-H-A-E-L, at Mollett, M-O-L-L-O-T.com. Okay, so again, it's Michael Hardy, and you can call me, email me, or you can go online and do your application right online, okay? And that's all you got to do. And then your deduction will start. You'll be participating in the 401k plan, and you will feel good about it, okay? So that's all I have to say. If you need me, you know how to get in touch with me, and I'm more than happy to come back to the organization and meet with you one-on-one if you need help. Thank you for your time, and take care. Bye-bye.
So my name is Latifa, and I'm a career advisor for Thrive Buffalo. Thrive Buffalo is a brand new initiative that launched in March. We're part of the Empire Poverty Reduction Initiative, and our focus is to get people to a sustainable wage. Our primary target are people who are underemployed, so those are people who have jobs that make minimum wage or low wages, and we help identify opportunities for employment or training programs to get to a sustainable wage.
So G Health, thank you very much for your time and attention this morning. We really appreciate it, from the executive team on down to everybody here at G Health Enterprises. For right now, I'd like to turn it over to your dynamic duo, Tony and Dr. Raul Vasquez. Take it away.
Ready? All right. Hi, this is Dr. Raul Vasquez. I'm here with my wife and my boss, Tony Vasquez. So G Health Enterprises, we'll start in terms of different systems. The reason we're trying to have these town hall meetings this way is also to try to get you guys informed. Because sometimes even we're in a big enough system that sometimes we don't talk to each other. So that's what I'm trying to do with the new model, G-Bond, which is the 3.0 version, is what I talk about. We're redesigning each department. It's going to be doing things differently. So you're seeing a lot of changes. And a lot of this is because of the growth that we have coming. We're looking to scale, and I'll tell you why in a few minutes. We're using a lot of performance dashboards to help us track a lot of data that we find is real important, and that's helping us design different types of workflow. If you're doing something within your system and you find that there's a better way to do it, please let us know. Because, I mean, Mark Twain's definition of insanity is what I see sometimes, and it drives me a little bit crazy, because let's not do the same things over and over at G-Bond and expect a different result. We really should try to do the best we can, and if there's ways that you find that we can connect to another department to make the system easier, I really need your help, because one person, few of us cannot really make this thing happen. It takes all of us to do this. I think the other thing too is we're trying through the performance to really improve communication and understanding, so we're trying to keep you aware of all the newsletter information, ways to really get information available. Like for the town hall, we were able to put a link in, just giving you information that we're seeing on call volumes, on different things that can really help us do a better job. And so we're looking for ideas, because I think it's really important. I know we've had restructuring that took place within some of the departments, and some of you came in for interviews. If you didn't get in this time, please don't give up, okay? Because that may have not been the position for you, but we're going to grow and we're scaling. We're coming up with different departments, especially in the care coordination. We're looking to create Health Home Plus teams and children's health home care managers. So there's still a lot of possibilities around our growth. The other thing is, each of the departments now will have weekly meetings, and in those meetings, I want things to come up. They're going to balloon up to the directors' meetings that are meeting twice a month. And there we're going to be looking at data. We're going to be looking at different things that are going to be quite important for us to not just have meetings, but they're constructive meetings. We want people communicating and finding solutions across the table, not just on opposite sides of the table. Just a little information that you should know. The Health Home G-Bond, we've been doing a lot of things. So sometimes we don't look at the good work that we do, but ER and inpatient utilization has been lowest among this health home and stayed low all these years. So that tells you that the work that we're doing among our teams is working, but there's always room for improvement. We were the first health home in the state to really use the community charts that you guys are using now. And I think being the first in New York State and having that capability is important, and we're trying to make it easier for our PHNs to get the best possible data. We're attempting to connect to the same fire and care community chart to Healthy Link and Psyches, first in the state to do that. So I just want you to know that some of the things we do here, they may look a little bit crazy, but they're the first in the state, and sometimes when you're first, people don't understand what you're doing. I think that's one of the areas that I wanted to comment on GBON. In terms of Jabanco, which is part of the team, one of the things that we wanted to kind of talk about is, as you all know, value-based is here and it's to come for the future. But Jabanco is the first and only ACO to have two value-based agreements. So we have an agreement with YourCare, you've heard this a lot, almost 9,000 members, and it's a 2-year contract that we just re-signed with YourCare. In addition to that, we have, and these are level 2 agreements, which means we're taking upside and downside risk with that population, is Fidelis. And Fidelis is a 2-year contract. Between those two contracts, we manage about anywhere from 21 to 22,000 lives. Those lives are going to come into the GBON system. And why am I saying that? Is when we compare data of all the other health homes in 2017 and 2018, GBON was the lowest cost. And when I mean lowest cost compared to Best Self, lowest cost, and sometimes by Best Self, we were lower than 100% of Best Self in some cases. We were lower than Health Home Plus, than Health Partners, and we were lower than Niagara Falls. And that tells you that the work that we're doing is really focused on the triple aim, which was a value-based about, where we not only are improving the quality and reducing some of those quality metrics like ER and inpatient, but in addition to that, these patients are getting a better care. So that's one of the things that I think it's important. The last thing too is, as we evolve, we're also going into different areas. And this will be the first value-based to really integrate telehealth in the state, which I think is pretty cool among the Medicare managed care. And we're hoping to translate that over to GBON in the future. So these are just some of the positives that are going on. We really need your help. I mean, I know that sometimes I get caught up on details because we need to kind of, if there's something wrong, I don't need to be, or our teams don't need, the directors don't need to be the people addressing that. The ground floors, the people that are on the floor are the ones that really change and do most of the work. So we want to listen to you and really come up with the ideas that best meet our needs, which are real important right now. So I'm going to pass it over to Tony to see if she has any recommendations other than that.
Thank you, honey. Thank you, GBON. Thank you for all that you do. I don't know if we tell you enough. I try to tell you as often as I can, but Raul and I really appreciate all that you do for GBON. We appreciate the lives that you are transforming, the lives that you're resuscitating, the lives that you are building for our community. We meet people all the time in our everyday lives and in going to different functions and different events. We meet people that are members of GBON, past employees of GBON, current employees of GBON, but the mantra is always the same. They're always saying how much GBON has impacted their lives in such a positive way. Even some that are not with us anymore, they really miss GBON and they really appreciate what we've done for them. So thank you so much. Thank you from the bottom of my heart. Thank you for all that you do. Please continue, like Raul alluded to, please continue to press forward, go for the promotions that are posted occasionally within our system. I appreciate all of you who have taken that leap of faith to try to do something bigger and better within our corporation. Thank you. We could not do it at all without you. Thank you again.